Hello guys and welcome back to my channel MedPharmaco Essentials. So in today's video mainly I'm going to highlight a most concerned topic, that is the obesity, which is nothing but a hidden danger it is. Okay, but most of the people ignore it. How much ever we tell them, they don't try to change themselves. So this is what I want to highlight, some of the points due to which their mindset might be changed and they start working on decreasing their BMI, weight and all the things. So let's move on to the video. So first of all, obesity affects your body and what you can do about it, we will know in this video. So let's move on. So first of all, before discussing about the obesity, everyone should know what is obesity or overweight. Overweight or obesity is nothing but having too much of fat in the body, more than what is healthier for your height and the age. It's not just about how you look, but how your weight is affecting your health matters a lot. Okay. So how do you come to know when someone is overweight or obese? We usually calculate the BMI of the patient. BMI in the sense, we take the height, we take the weight of the patient and we put it into a formula. Automatically you can generate it through your system also. So the BMI, whatever is showing, if it is from 18.5 to 24.9, then we consider it as normal body mass index. If the BMI is 25 to 29.9, we consider it as overweight. Obesity 30 or more, it is called as obesity. So why is obesity a problem? Because it can lead to further complications like diabetes, high blood pressure, heart diseases, joint pains, breathing problems and some of the cancer issues. So how it can cause the diabetes, I'll just tell you. When you're overweight, your body has a harder time using the insulin properly. This can cause a very high blood sugar rise and thus leading to the type 2 diabetes condition. Extra fat, especially around the belly, will increase the insulin resistance in the patients. So extra body fats will put more strain on your heart and blood vessels, and thus the heart has to work harder to pump the blood, right? So thus increasing your blood pressure also, and high blood pressure automatically, you know, it can damage your kidney, heart and brain all over, right? Over the time it can damage all the things. So next, yes, obesity can also cause heart disease further if you don't manage it. So obesity can lead to high cholesterol level, high blood pressure, high sugar level, which is a dangerous combination for the heart. Okay, so fat can build up in the blood vessels, blocking the blood flow and thus causing many heart attacks and stroke episodes. So you should be very careful when how this obesity also affects your heart. So yes, this is common. Obesity can also affect your joints, so especially the knee and the back joint, I can say. So extra weight will be put, more pressure will be put on your joints, especially the knee joint, hip joint and the back joint. This can press down the cartilage and then leading to the arthritis and very chronic pain. So decreasing your BMI can indirectly decrease your joint pains, what we can expect in these patients. Breathing difficulties. Yes, the fat around the neck and the chest can block your airways while sleeping. This can cause sleep apnea, what we call. Sleep apnea is nothing but a pause in breathing during your sleep, which leads to poor sleep and daytime fatigue condition. So extra weight can also make the lungs and the chest muscle work harder than usual. So this obesity can also lead to breathing problems also. Let us discuss some of the 10 easy and effective tips to lose your weight. First thing is, eat more home-based foods. That means cook simple meals in your home instead of eating outside, or avoid any deep frying oily kinds of food. Choose rotis over naan, steamed rice over fried rice. So you can do small changes due to which your weight can be reduced. And second thing is, cut down your sugar and sugary drinks whatever you drink, because what happens if you drink too much of tea, too much of coffee, it is not good for your health and it will just go on increasing your weight. Instead of, you can go for lemon water or buttermilk, green tea, plain water to get yourself hydrated rather than drinking too much of tea or any sugary drinks. Okay, And next thing is reduce salt and processed foods like chips, it might be noodles, it might be packed snacks, it might be more amount of salt, more fats, more calories can be harmful for you. And instead of that, you can choose fresh fruits, fresh vegetables, sprouts. Next is reduce salt and processed foods. Eat smaller portions of meals, okay? Don't refill your plate unless you're very hungry. Stop eating when you're 80% full. Leave some space for your body to digest whatever you have eaten. Your body every day, walk at least 30 minutes daily, use stairs instead of your lifts. Drink plenty of water, at least 8 to 10 glasses of water daily. Sometimes when you feel hungry, when you're really thirsty. Get good sleep, at least 6 to 8 hours per day, so that you balance hormone that can control your hunger. So sleeping late often leads to late night snackings, and that can increase your weight. Limit the use of mobile and TV time. Avoid eating while you're watching screens, because the more you sit, the more weight you gain. So keep a simple food diary, what you can keep. Write what you ate in the notebook and app. You will become more aware of what is going inside your body. Be patient and positive. You don't gain weight overnight, so don't expect to lose it overnight also. Focus on the progress, not on the perfection. So this is the small steps that you can take in order to reduce your BMI and the risk condition in the future. So stay tuned and keep watching. Thank you.